started. Good afternoon, everyone. My name is Nicole Fernandez Dias, and I have the honor of introducing our Education Grand Round speaker today. Dr. Aimee Bernard is an assistant professor in the Department of Immunology and Microbiology at the University of Colorado Anschutz Medical Campus. Aimee is a dedicated educator who teaches immunology to a variety of professional students across the CU Anschutz Medical Campus and serves as the Immunology Content Director for the CU School of Medicine undergraduate medical curriculum. Aimee's also passionate about science communication and serves two roles in this capacity as the director of the CU Anschutz Basic Sciences Department's Science Communication Program and as a co-director of the Colorado Clinical and Translational Science Institute's Communicating Your Science to the Public workshop. In all of her roles, Aimee strives to serve as a positive influence on education, science communication, and public policy. Please join me in welcoming Dr. Bernard. Thank you for being here.
Thanks for having me. It's exciting to be here and to talk about one of my favorite topics. I'm very happy to be here. And one of my passions is, besides immunology, science communication. So we'll talk about making science interesting and relatable, and also add in some information about how to make this type of work scholarly activity. So let me see here. All right. So science communication, because facts and scientific evidence should inform public decision making. And this, I've given this talk many times before in the past in different kind of variations, and it seems that it is more appropriate than ever moving forward. So, yeah, important to do. And then another bit of information is physicians and scientists should be trusted sources for information in the realm of science, medicine, and health. And I think that we've all kind of noticed maybe, unfortunately, a little bit of a decline in that. But hopefully we can all work together to bring us back to being trusted sources. All right, so this will be a little bit of a call to action today. So I'm going to give us a couple of reasons to have this presentation be a call to action. And one of them would be to uphold public health in our communities. So I'm going to give you a little bit of background. For those of you who may or may not be familiar, your local epidemiologist, or Caitlin Genelina, kind of came onto the science communication space during the pandemic. And she is someone that I actively follow. She's a really good, trusted force. She's an epidemiologist, has a lot of public health expertise. So I look to her for a lot of guidance and direction in some of the things that I do. And she just recently wrote on November 8th, "Now what for public health?" And we need to be ready for a new world. So again, this is part of the call to action. Acknowledging that public health transcends politics. This is not meant to be political in any way, but I think that some of the things that are happening in regards to public health and maybe who will be potentially in charge of public health, it seems as if we're entering into kind of a new world. And this is coming after a couple of years of public health being put through the ringer as far as some of the I would say lack of trust or changing information landscape as far as social media and a lot of other types of influences that are maybe out of our hands. So how we navigate this new world will matter. And I think that the way that we can do this is through thoughtful and clear communication together as scientists, physicians, public health experts, trusted health professionals. So our job to participate in sharing our expertise and our knowledge and being proactive rather than reactive is more important than ever. Sadly, I think one of our biggest challenges, and again, this comes from your local epidemiologist or YLE, but I completely agree. One of our biggest challenges is going to be fighting for the truth. There's a lot of falsehoods, rumors, fake news, misinformation, disinformation, and other things that play a role out on the internet, in social media. And we need to be trusted sources for people that will fight for public health, defend public health, and share our expertise in ways that are accessible to the general public. So another call to action beyond just upholding public health is to connect with people in our communities. If you look at some of the articles in a variety of different kind of news sources, this is from an organization called Undark that I follow. They have a lot of good articles. Science has a communication problem and also a connection problem. So the public doesn't necessarily see scientists as people. Sometimes they see us more of sources of information, and there tend to be some barriers that stand in the way. That connection between scientists and I would say doctors maybe don't have this as much, but to some extent in social media, just not seeing as human or having that human connection. Probably one-to-one in the clinic, but when things are written in the media. So there are some barriers that stand in the way to humanizing scientists, but also getting scientists to participate. So a couple of quotes that I found that I thought were useful from that Undark article that we just saw. Top-tier research institutions, most scientists, their primary responsibility is to get grants. This is helping to fund their research and their salaries. So anything that supports that research or being able to further their research is rewarded. And that's rewarded with promotion and tenure and keeping your job. On the flip side, anything that does not support that, including public communication, is often treated as a distraction, particularly if scientists aren't getting those grants and the funding that they need. The little bit of science communication that does come out of academia appears to be a product of a passionate hobby. So a lot of the people that are engaged, it's not something that they typically would get paid for or would go towards furthering their career. And there are a lot of pressures on physician scientists and scientists. Oops. And then lastly, the last quote that I will talk about from this article is that science outreach is hard, but we as scientists and medical professionals, we're used to doing hard things. And if we were rewarded for public communication by making science communication training part of our professional development and making engagement with the public a part of our portfolio that leads to tenure and promotion, this would likely change. So in the context of that, I have some good news for everyone. Another call to action, another reason to do this is to enrich your promotion portfolio. And yes, this is true here at CU Anschutz Medical Campus. So what I'm about to show you here are some screenshots from the CU School of Medicine promotion matrix. And I have to tell you that I reached out to Dr. Lowenstein to make sure that all of the things that I put into this, that I got from this promotion matrix were, yep, this would apply, this works. So here we're going to look first at the scholarship of application. So under research and scholarship, as you'll see here under meritorious, there is examples where science communication could be used in your promotion matrix. So co-authorship of articles, policy reports, or other publications related to clinical or health services topics. Other publications could be electronic communications, like in The Conversation or Undark, or a lot of different news sources where you're talking about clinical or health service topics. Under the categories of excellence, There are other things that you can do in the context of science or medical communication. So, multiple publications related to health system science topics, case studies, policy reports. Again, the word other publications that have advanced the science and practice of healthcare quality or improvement. A lot of what you could do in the science communication or medical communication space could fit in this category. And there is another here under excellent for scholarship of application, articles, white papers, or other written or electronic products of scholarship that focus on healthcare advocacy, equity, community service, other activities. This could be blogs, podcasts, articles. These are the types of things, as long as they're science and medical communication, they could fit in that matrix. And then there's other evidence of clinical scholarship, um, contributions to publications, national presentations, these things that promote healthcare quality, equity, or patient safety, advance science and practice of healthcare. These are all things where science and medical communication could count towards your promotion. So you could, here at CU Anschutz, we can participate in science communication and add it to your promotion matrix as well, which I think letting people know this would be a driver of change for getting people involved. You can also find some in the meritorious and excellent category under teaching. So potentially developing or redeveloping teaching materials for students for continuing education or faculty training. This could be in science and medical communication. Under excellent, development of mentoring or coaching programs that focus on career development, academic advancement. This could also be communication practices potentially. And then development of innovative teaching methods, educational websites, packaged courses or workshops. These could be science or medical communication. So these are just a couple of examples. So we've covered scholarship of application. We've talked about teaching. You can also see this under clinical activity. So under meritorious and excellent, you can see that there are participation in community collaborations that strengthen educational, clinical, or research partnerships, as an example. If you look on the excellent category, contributions to workshops or training programs that address challenges in diversity, equity, and clinical settings, focusing on bias, microaggressions. These are things that potentially could also be added into science or medical communication. So just trying to give you all a little bit of a driver for adding science and medical communication to your portfolios, because this will help with promotion matrix. And I would also argue that if you are already a full professor and tenured, you should still do it anyways. So not just all of us that are still moving upwards. We need all hands on deck. Okay, so now that I've given you some background on why we should all participate to connect with the community, to uphold public health, and also to enrich our own promotion portfolios, I'm going to go over the top 10 tips for effective science communication with the general public. So I'll go through each of these just one at a time, but I've listed them all here. But we'll do one at a time so it's not overwhelming. So first thing is to know your audience. So when you are about to give a presentation, some science communication, medical communication, you should know your audience. Are you talking to fellow colleagues? Are you talking to a group of parents from your local elementary school? Have you been invited in to talk to kids at the elementary school? For those of you who are MDs, I know that you do this quite a bit with your patients. The majority of your patients likely are not science experts or in the medical profession. So you likely know that audience is someone that would need a little bit things more broken down for them or simplified. I'm going to just tell you right now, when I teach students or other faculty about science communication, I will always say simplify. I absolutely hate the term dumb down. And when anyone uses that, I strike it from their vocabulary because you're not talking, everyone that you're talking to has a specialty or an expertise or something that they're good at. So I ask people who know things that I don't know to simplify for me. So I will simplify for them or to make it understandable. So just keep in mind who is your audience. And then another thing that might be helpful to you is to know what their thoughts are. So as an immunologist and a vaccine advocate, I will often testify at the state legislature for pro-vaccine common sense science policy. And I know that when I go into the when I go into the room to testify, there are a lot of angry and unhappy people. So I'm ready for that. If I go into a group of high school students, they're usually curious and happy. So it's sometimes it's helpful to just have the frame of mind of your audience in mind when you walk into the room. Um, Second tip would be identify your goals of communication. This could potentially change your message a little bit. Are you at the state capitol to influence policy or encourage change? Are you answering questions? Is it like a parent panel, like a Q&A? Are you trying to build trust with community members that are skeptical of, vaccines or different types of medicine or science? So identifying your goals, knowing your audience and identifying your goals could be very helpful. Um, the third would be to start with the most important information first. You might want to start with the take-home message or key findings first. This has to do a little bit with attention spans. Sometimes attention spans, I would say these days, are not lengthy. So if you can communicate your very important take-home message first, you can then always give a little bit more information, maybe launch to a deeper conversation, follow it with some supporting science or messaging, but start with that take home message or key finding first, just so that they get that to start. There's a little bit more conversation, then you're obviously going to want to summarize with that again. So you're going to answer like the what's in it for me? Like what is your audience or your stakeholder? Why should they listen to you? What's that key finding? What's that important message? Along the lines of starting with the most important information, I would also say, think about framing the message. So you can communicate science or medicine or medical advancements in a lot of different ways. But sometimes framing it in a certain way, framing the message that's easiest to accept, would probably be the best way to start with your audience. And I'm going to give you an example. Think of the HPV vaccine, so human papilloma virus. The message is most successful when it's delivered as cancer prevention. Like, wouldn't you be excited if you could prevent cancer in your child, in their adult life? As opposed to saying you're preventing the spread of a sexually transmitted infection. Those are both true. That is absolutely this. It's different framing for pretty much the same thing. Most parents that I have spoken with as a vaccine advocate and immunologist, they really like hearing about cancer prevention, not so much the sex part. Especially when it's kids 9 to 13 that are recommended to get the vaccine. So this is just framing. It's both of them are true. Both are accurate, but it's maybe just a little bit easier to swallow sometimes. Okay. Fourth, avoid jargon. As you'll see, I like cartoons. Communicate using easy to understand language. So if you have a complex topic that you're thinking about, the best way to communicate that would be to come up with some explanations and then test them. Like it's experiments, like experimenting on colleagues, friends, family members, people in your community, neighbors. What lands best with them? You might have an idea of how something really works and you think it's a great explanation, and then you tell like 10 people and they're 9 out of 10 are like, what are you talking about? You need to test explanations. So explore multiple explanations until you find the words and the analogies or metaphors or stories or whatever it is that works the best for most people. This is really to avoid being called a sesquipedalian. I thought I would add in a big word for us. This is someone or something that overuses big words. So nobody here would want to be called that, obviously. So let's avoid jargon. By the way, when I first started giving this type of talk, I didn't actually know that that word existed, but now it is one of my favorites. So you're welcome. Um, all right. So being relatable, and we're going to see a couple of slides here about being relatable, because this is really important. This is the humanizing of science communication. And I know that physicians are probably pretty good with this in the context that you see patients all the time. Bench scientists, not as much. So we need a little bit more practice. One way that you can be relatable is to use analogies or stories to make science accessible and personal. So one analogy that I came up with, and by the way, this graphic is homemade. I took screenshots of this cute little teddy bear and screenshot of the vaccine. So that's why it looks so rudimentary. But during the pandemic, I was talking to people about vaccines and COVID vaccines like almost every day. And we found out early on that while the COVID vaccine did not prevent infection, it does prevent death and decreases serious harm or injury. So I used the analogy of a seatbelt. COVID vaccines are like seatbelts. They may not prevent the crash or infection, but they prevent serious injury and death. And when I would tell people that, that seemed to land pretty well with a lot of the general public that I would speak to. So that was something that I think having analogies that are relatable, like everyone knows what a seatbelt is, or at least they should. So that can be really helpful, something that's relatable. Another piece of being relatable is stories. So this is a true story for me. Back when I was 13, my mom was diagnosed with type 1 diabetes, and I was in shock. Like, what is happening? Why is her body attacking itself? So I started reading it. I didn't really know much about immunology then. But I started reading about it, reading about diabetes, and that's what drove my desire to pursue a career in immunology and then focus my PhD on autoimmunity and autoimmune disease. So I will often share that information or that story with people to let them know why I was driven to immunology. And that often helps people connect to why I do what I do and why I'm an immunologist. And I think sometimes that gives me a little bit of credibility for people who are skeptical of science. This is a fabulous resource. It's a 13-minute video. It's on TEDx. This Fergus McCullough is a fabulous storyteller. He will tell you about his research in the wood frog. Wood frogs, just to give you a little kind of appetizer, they freeze and then they come back to life in the spring. So he gives like this beautiful story about his research and why it's so fascinating for him. So stories can be very powerful. Another aspect of being relatable is to put yourself in the shoes of the person you're talking to. So to be empathetic. I know sometimes this can be challenging if people are coming at you with fake news, disinformation, very argumentative, but putting yourself in their shoes. So when I talk to people about vaccines, I do this all the time. And I will say, like, a talking point is I can understand why you have questions about vaccines. I and you both want to make the best decisions for ourselves and our family. and you want to make sure you understand the risks and benefits before vaccinating. Usually I'm talking to someone who's not an immunologist like me. So then I ask for permission. And while I'm not going to go into things like motivational interviewing or different types of biases and things that would help drive people's decisions, asking for permission, like, is it okay if I share with you what I know about vaccines as a mom of twins? I'm also an immunologist, and I've studied the immune system and vaccines for over 20 years. And that will often, asking permission of people will often, it can be very beneficial because they don't want to see us as experts that are just forcing facts down into their brains. They want us to see them as like an equal where we can share our information with them. So that's often been pretty successful. Okay, so that was a multiple different reasons to why we should be relatable. Another tip for science communication is if you can, provide visuals. Visuals can be very engaging. They can help people to learn or focus or understand things. I know that if you're like walking on the street, you're not going to pull a whiteboard out of your, well, maybe you would pull a whiteboard out and start drawing things. But if you're in a, in a talk, um, if you're in an environment where you can provide a visual, and that's where sometimes analogies or stories can be helpful because people can provide visuals in their own mind if you paint the picture appropriately. But providing visuals can be very engaging. I often like to add a little humor, so I find I think I mentioned earlier that I teach immunology to the med students here on campus, and they know my love of science cartoons. So this is just a small snippet of what of what they see in class. But I think adding cartoons and a little humor to make science more fun. Humor can often break down barriers in communication as well. So I often like to add in cartoons and things like that if I can. Another talking or point for effective communication would be to stick to 3 points or less. Again, this goes to attention span, where we said to start out with like the most important or key message first. When you're speaking to someone about science or medical communication, 3 points or less is really going to help to drive that information home. If you do more than that, you might be a little bit overwhelming. So 3 points or less. For those of you who are of my vintage, you will notice the Tootsie Pop owl in the right. If you're younger, you might not. You can look it up. It's a fun commercial. But as an example, in the context of COVID vaccines, 3 things you want your audience to remember. COVID vaccines may not prevent the crash, but they do prevent serious injury and in most cases also prevent death. So those would be kind of my top 3 for COVID vaccines. This 8th one, it's another, can be a very effective communication tool. This may not work for all conversations, but I do find this to be helpful, talking about the scientific process. And the reason why this can be incredibly helpful is that patients, community members, anyone we're talking to, if they don't know the scientific process or the scientific method, they may not know that science is always evolving. It's dynamic. We follow the data. We may get new data and we're going to then possibly revise what we've said in the past based on new findings or more information. So if you talk about the scientific process, often that can be helpful. So you can say, at this point in time, based on the data that we have, we feel very confident, X, Y, and Z. And then that will leave room for changing your mind and saying that with more information, we will bring in updated information. So I often will tell, we'll try to frame it in a way that I'm talking about the scientific process. Again, can't be jargon filled, and people don't like looking at data. I know it's sad. Every single person on this Zoom, we all love data. We have lab meetings. We show people data. We draw data. But data, there have been studies to show data just it doesn't necessarily work. Potentially like a very easy to understand colorful graph or pie chart, but even that sometimes. So no jargon filled or data filled detailed information. So again, science is always evolving. We make new discoveries, we learn from them. This is also true in the context of public health. As new information is evolving about different infections, we're going to be using that information to maybe revise what we're saying. And then this is an important aspect too. If you do talk about the scientific process being dynamic and changing, this can plant the seed where it will help to combat the spread of mis and disinformation, because people that we're talking to will understand that science is evolving, that it's a process, that we make new discoveries and we learn from them. So that can sometimes help to alleviate, I think, some of the fears and anger that people will see from mis and disinformation. Another talking point here is to focus on our effective tool, focus on the bigger impact. Sometimes this will help people kind of solidify what we're trying to communicate. You can focus on health. You can focus on education, policies, money. Money often helps. um, so as an example, if you were to say, if you and your family get vaccinated, it's for health wise, it will protect you and your family, it will protect your community, it will decrease the spread of disease, but also it will prevent you having to stay home if your kids are sick, or you having to stay home if you're sick and losing salary or wages or things like that. So sometimes, or even insurance, sometimes, the better you take care of yourself, sometimes, insurance may, I'm not exactly sure, but may reward that. Okay, so the last thing, and this is where I'm going to ask some of you to be interactive. And I know that we don't have a ton of people on the call or on the Zoom, and I can't really see any pictures of you except for a few, but we are going to develop an elevator pitch. So and we're just going to take a couple of minutes, and what I would love to see is people take just a couple of minutes to develop a 1-minute elevator pitch. The elevator pitch, the idea behind this, if you haven't done this before, is that you have 1 minute in an elevator in which you can tell the person that you're riding with what you do and why you do it. And it's going to be easy to understand, and 30 seconds to 1 minute. So it doesn't have to be complicated, and it shouldn't be complicated. So I'm going to give you an example of an elevator pitch that I have, more or less, for a podcast that I run with a friend of mine from grad school. So we have a podcast called Help Make It Make Sense. We started it during the pandemic because we were getting so many questions. She's an MD, PhD, immunology, med peds doc, and in Brooklyn. And we just were getting so many questions. We were like, yes, let's make it a podcast. So here's our elevator pitch. Do you get overwhelmed by science? Does it mystify or scare you? Have you ever wondered if scientists are normal people and why they use so much jargon? You're not alone. So we then talk about our podcast, how we will help people separate the truth from, notice that this is spelled backwards, the bull-tish, so it is not a swear word. And that we just share our information. So that would be an example of what we do in our podcast. So what I'm going to ask you guys to do is take 1 minute. This will be for a colleague. So take a few minutes. Let's see what time it is. It's 12:37. Let's take 2 or 3 minutes. I'm going to have you write a 1-minute overview of the work that you do for a fellow colleague. And then I'm going to see if any brave volunteers would either come off mute and give us their pitch, or and again, you can use jargon. This is fellow colleagues, so this is your first attempt. You can use jargon. Okay, I'm going to 2 minutes on the clock. Time flies when you're having fun. 2 minutes has passed. Is there anyone you could type in the chat if you want, or come off mute and just tell us again to a colleague, 30 seconds, 1 minute, what you do, your research or your focus. I can see all your names, right? That was the beauty of teaching on Zoom. Like, oh, I know everyone's name. Let's see. Any brave souls? Anyone Hunger Game fan? Anyone want to be tribute?
Okay, I can go.
Okay. Thank you.
Yes, what I wrote down is I am a big E clinician educator who focuses on career development and identity formation of medical trainees, especially those who want to pursue academic careers within medical education and or neonatology. And I do this in order to empower people to reach their most balanced potential by encouraging self reflection, aiming for clarity, building relationships, and emphasizing essentialism.
Wow, that is awesome. Thank you. Do we have any other brave souls? Oh, in the chat, you got winner, so nobody else wants to go. Oh, Dr. Nussbaum. Okay, so uh I do have one other well, we're not even close to being done yet, but I have another activity. We'll go with Nicole's, but in essence of time, because I have more things to tell you, I now would like you to take what you just wrote, assuming everyone on the call or Zoom did that, and I now want you to take that and convert it to 1 minute overview of what you do for the general public. So you're riding in an elevator, not with a colleague this time, but with someone who, let's say it's your grandma, assuming your grandma doesn't have your same specialty. So I'm going to give 2 minutes on the clock again. Sure, all of you know this, but this is called active learning. You are doing things during class that help you. All right. Nicole, I hate to do this because you were a brave soul before, but I would say that it would probably be very beneficial for us to have a comparison. Would you be okay with that?
Yes, we'll give it a try. What I wrote was I am a doctor who cares for newborn babies who are very sick, but my main focus outside of being a doctor and my passion is being a teacher and mentor to those who also want to become doctors, especially if they want to be doctors that are also teachers or doctors that also care for really sick newborn babies. I do this because I love to empower people to reach their greatest potential. And I have several strategies that I utilize to try to accomplish this. That's as far
Awesome.
as I got.
Yeah, no, that's great. I think even before talking about the strategies, like before that, that could have been your short elevator ride. I think that would be really good. So, because we only heard from you, but I think other people could chime in on this because I know that everyone did the assignment, even if they didn't share it with us. um, when you're comparing what you wrote for a fellow colleague to general public, like what are the things that are different? What would people say are different? You can type this in the chat if you would like to do so. I'll start. You're not a sesquipedalian. So you don't use big words, right? You're gonna avoid jargon and yeah, less jargon. So break it down. Yeah, and finding a common starting space for people. Ellen, shorter. Yep. It can be shorter. I find sometimes when you're communicating to the general public, because you can't use concise terms, sometimes it's actually a little bit longer. It just depends. Um, Another comment, found myself stopping and thinking, what most people know what it is. Yeah, you have to really think through the word that you're using. Would people know? Like, I'm glad you didn't use neonatology because I think that would that would that would not land. So new babies. Yeah, that was perfect. Yeah, and I see a comment here. Mine was longer since I had to describe what genetic counseling is. Absolutely. I find that my general public elevator pitch is a little bit longer because I can't use antibody or somatic hypermutation or whatever terms whatever jargon you have to explain that, and sometimes it can be a little bit longer. So absolutely, I think you guys all have the hang of it. If you haven't ever done an elevator pitch before, I highly recommend that you do. It can be very beneficial. The way that I try to sell it to my colleagues is you never know when you're going to be in the elevator with a donor. Right? Or someone who'll be like, hey, what do you do? And then they become interested and maybe they would feel, grateful for what you're doing. So, um, yeah, or meeting someone at a conference. Absolutely. That's the or looking for a job, maybe you're networking at a conference and you're looking for a job. So thanks everyone for playing, and particularly Nicole for for being volunteering as tribute for us. So I do have a couple more things I want to tell you about science communication. Um, why wait until you're in an elevator? We should be proactive. Some of the things that I told you earlier on in this presentation was that we need to defend public health. We need to connect with our community. We need to do all these things to make sure that our patients, our family, our friends, our colleagues, everyone stays healthy and safe, and we should become proactive. So one of the things that I did that I would encourage others to do if this seems like something you're interested in, multitask your promotion packet. I submitted my promotion packet in this summer. I haven't heard back yet, but I hear it takes quite a while. So fingers crossed you see me again. But I multitasked my promotion packet. I decided I didn't want to write 100 pages of information and do nothing with it. So I made my own Wix website. This is actually, it's free. You can use Wix, Squarespace, whatever. But everything I wrote comes from my promotion packet, things that I had written up, but this is for the general public. And I actually have a science communication tab where I tell people communication of science to the public is critical for many reasons. And then I share all of the different reasons. This is just a snippet of a couple of the things that I've done, but you can, again, going back to your own personal advancement, multitask your promotion packet. And you can, the other thing is if you are going up for promotion the next year, you could do this and then have all of these things here. It's like I think this is an interactive CV essentially. And I found it just made me feel good too. Like, look at all these things I wrote on this 100-page document that like nobody else but a couple people will see. So it made me feel, I think, more productive. So that's one thing you can do. Um, Other ideas for being proactive. Dip your toes into social media if you want to. Um, I make little silly TikTok videos. I share things on Instagram. I fun size immune ninja is my handle. I put it on threads. Why is it fun size? It's because if you don't know me, I am the size of a 12-year-old as an adult package. So I've been called a fun size candy bar by my kids' friends. And I also do I I also do martial arts, so that's where the Immune Ninja comes from. But things you could do, blogs, podcasts. I run a podcast with a friend of mine, but I also have been interviewed on different podcasts. You can write op-eds. I wrote an op-ed in the Pioneer Press, offering tips to assess science and health info. I wrote a guest commentary in the Denver Post after a common sense vaccine bill got shot down, and I was mad. You can write in the conversation about science and furthering information about science. So there's all these different things that you can do to increase your portfolio, but also to get out into the world. It doesn't necessarily have to be a talking event or a speaking event. It can be writing and getting that out there. The conversation, if you haven't heard of this before, the conversation is very widely read. And it is vetted. You have to pitch it, you have to be an expert, and then editors will work with you on that. And I've done two articles there, and I think this article here that I'm showing has had, I think, over 50,000 reads because they track it. So it's pretty. Some of this can be pretty well read, so it gets out there. Other things that you can do is so one of my roles here is I was hired by the 6 basic science departments to help scientists write about their science. So I have partnered with different basic scientists across campus, and I will read their research and I will write up what they do, and then we then work on it together. But we have a website where the basic science, it's written for the general public. So I'm helping a large number of basic scientists to get their science out to the general public in ways that are understandable. And then this is kind of a briefer synopsis that CU Today, that electronic newsletter, has agreed to make a Meet the Scientist column based on what we're doing. And every other month they will feature a different scientist. So this is one of my colleagues down the hallway from me, Kyla Ost. And this is her Meet the Scientist column that you can find in CU Today, but also on our website. And if you would want help writing your things up, I'd be happy to help with that as well. So things that we can do, just kind of brainstorming a little bit more, things that we can do to become proactive. So I would say a couple of ideas here. Engage in intentional conversations. I would say don't shy away. All hands on deck, especially in this new public health world. Everyone has to be brave. We do hard things every day. We can communicate our science. We can take complex things and break them down. So be intentional and engage in these kind of challenging conversations. Dip your toes into social media. Start putting up posts on LinkedIn, Blue Sky, Instagram, a lot of different places that you can get plugged in. I would say Blue Sky is recently become a really good site. There's so much good science there. People are moving away from a different platform onto Blue Sky. You can write op-eds, guest commentaries, pitch articles for the conversation or Undark. There are a lot of different things. You could even talk to Chris Casey. He's the director of digital storytelling at CU Today. He will often work with scientists to write up what they do because he thinks it's interesting. So, and people want to read about it. And just so you know, CU Today, it has about 15,000 subscribers, and about 1/3 are not scientists or physicians, like they're community members. So it gets out there beyond our walls. You can talk. So you could be on a podcast. If you notice here, there are a variety of podcasts here at CU Anschutz. There's CU Anschutz Health Science Radio podcast. There's CU Anschutz 360 podcast. There's Children's Colorado Hospital Charting Pediatrics. There's Project Bridge is launching a podcast. I think they're going to call it Science Bridge. In January, there's a grad student on campus that runs a podcast called Flying Intuition, and he interviews scientists and physicians all the time. So there are a lot of different things you can do as far as talking about your research. Another idea would be to advocate. I testify at the Colorado legislature in support of pro-science legislation or in opposition to bills that would weaken public health every year. So that's another thing. The beauty of this is that anyone can testify. The detriment is that anyone can testify. So please join me in supporting pro-science legislation. I always do it on behalf of myself. I can say that I work here, but unless I have specific instructions or approval from the university, I will say I'm Aimee Bernard. I'm an immunologist, and I am speaking on behalf of myself. So anyone can do that. You do have to take the day off or that time off when you're doing it, though. Because I just wanted to give you a heads up on that. So that's it. That's what I have. I'm sorry if I went a little bit. I meant to have more time for questions, but we had an active learning segment. So with that, I will ask if anyone has any questions or comments. Oh, someone in the chat wrote, Wendy Meyer said that CU Anschutz today gets to 20,000 people or more. So that's great. Awesome. So it's a wider audience than I said, so that's wonderful. Anybody else? Oh, thanks, Ellen. Really, Ellen wrote in helpful framework for thinking about science communication. Well, thanks. I appreciate that. All right. Well, with that, all right, Kara, what do you think?
Perfect. Thank you so much for coming today and speaking. And this had so many great ideas, and I love the active learning. So we appreciate it. And please, everyone, evaluate this session.
Don't forget to evaluate.
It's in the chat, and see you guys all next month. Thank you.
Yeah, thank you guys so much. Thank you, Dr. Lowenstein.
Thank you very much. That was wonderful.
Thank you. I'm going to stop my share. All right. Hey, Erin.
Okay.